hospital waste management. So biomedical waste is defined as the waste that is generated during the diagnosis, treatment, or immunization of human beings and are contaminated with patients' body fluids like syringes, needles, ampules, organs, body parts, placenta, dressings, disposable plastics, microbiological waste from the laboratory. Okay, these all are when are they generated? When you are in contact with with the patient. Okay, and when is the healthcare in a contact with the patient? During the diagnosis, treatment, immunization, operations. Okay, that's when the healthcare is in contact with the patient's body. Okay, so whatever waste is generated during these processes, we consider them as biomedical waste. Okay. There are various terms used for biomedical waste, like medical waste, regulated medical waste, hospital waste. Okay, these are other names as well. The risks that are involved with poor waste management are nosocomial infection, which means your healthcare associated infection, risk of infections to waste handlers outside the hospitals, like rag pickers, general public. Okay, if you don't dispose it properly, there's a risk for infection for these people as well. Injuries due to shots for waste handlers, people within the hospital. Okay. Coming to the classification of general waste, classification of hospital waste. According to the World Health Organization, the hospital waste is classified into the following categories. You have general waste, the waste that is generated from the office, administrative offices, kitchen, laundry, stores. Then you have sharp waste, needles, needles attached to any IV set or tubings, scalpel blades, razor, broken glass. Okay, broken glass slides from the microbiology lab. They come under the sharp waste. Infected waste, equipments, instruments used for diagnostic and therapeutic purposes. Waste from any surgery, any operation theater, like tissues, organs, amputated body parts of the patients. Okay, we all consider that as infected waste. Then you have chemical waste, formaldehyde used for preserving tissues and organs, any fixers used in developers in radiology department where the film is developed. Okay, solvents used in the laboratories like xylene, acetone, ethanol, methanol. Okay, if they are expired, any expired solutions, even from the housekeeping department, if you have any disinfectants, enzymatic cleaners which are expired, they come under chemical waste. Radioactive waste. Various radioactive waste are generated through activities of the Department of Nuclear Medicine and Radiography. So whatever is generated, any isotopes, okay, they also come under radioactive waste. Then cytotoxic drugs, all anti-cancer drugs, expired or non-expired anti-cancer drugs will be considered under cytotoxic waste. Cytotoxic means which are toxic to the cells, living tissues or living cells. So these are the classification of hospital waste. There was an old category which is not used these days because this was very extensive. Okay. And teaching the biomedical waste handlers, housekeeping staff, and even the nurses and student practitioners to teach them and to make them remember the waste category, the 10 waste category, was quite tedious. Okay. So later, the World Health Organization has developed the 4 main category of waste, and still we follow that. This was the old category. It was used at least 10 to 12 years back. We were using this 10 categories of waste. Okay, right now it is no longer used, but just for your reference, we have shown you the 10 categories of hospital waste. Category 1 is all the human anatomical waste from operation, surgery, biopsy department, amputation. Animal waste, so category 2 from veterinary hospitals. Any research centers as well where anything is tested on animals. Category number 3 is microbiology or biotechnology waste from the laboratories. Category number 4 is sharp, any type of sharps. Category number 5 is discarded medicines, cytotoxic drugs, expired medicines. Okay. Category 6 is soiled waste like linen, bed sheets, anything that is soiled, which has become which has become dirty through patient contact. Patient fluids have been in contact with any form of uh, articles or equipments that comes under soiled waste. Usually clothes, textiles come under this category. Category number 7, solid waste, which is not liquid, solid waste, which can undergo autoclave or undergo any tempering. And category 8 is liquid waste from the laboratory. Category number 9, incineration ash. After after incinerating, whatever is left behind. Okay, after you incinerate category 1, 2, number 1, number 2, number 3. So ash that remains is called category number 9, incineration ash. Category 10 is chemical waste. Expired drugs. Okay, expired medicines, expired drugs, solvents, detergent, disinfectants, reagents used in the laboratory. They all come under category 10. So these are the 10 categories. No longer is used right now. Coming to the hospital waste management program. So there are different steps in the waste management program: generation of and segregation of waste, collection and storage of waste, transportation, moving the waste from the department to a sorting area in the hospital, and from the sorting area to the final disposal area. So there are two types of transportation of waste: within the hospital and outside the hospital. Then treatment of waste, depending on the type of the waste, how you will get rid of it, making sure that just by getting rid of it from your premises is not the goal. You have to make sure it is no longer harmful for the environment and then get rid of it. That is treatment of waste. Disposal of waste, the final destination of the waste, landfills, uh, slurry waters. Okay, usually those are the incineration centers. Then managerial and ethical issues related to waste management program. So we'll go through all this. So any hospital or any healthcare facility, if you take the waste management program, follows the same process everywhere. This is a universal process we follow in all healthcare setups. Okay. Also in research departments or even in veterinary hospital, the same process is universal. It has to be followed. So the first step here is the green box you see is generation of waste. When you do any procedure where the healthcare system comes in contact with the patient or a receiver of a treatment, okay, you are in contact with the patient's body. So during this contact, it could be some diagnosis, procedure of a diagnosis, could be a treatment procedure, okay, anything. It could be immunization as well. So when the healthcare system comes in contact with the patient while using equipments or articles, waste will be generated. Okay, so that is a generation of waste. And when you discard this, soon after handling the patient, when you are discarding the waste, at that point itself, segregation has to be done. Okay, at the point where you start giving the treatment, care, or service. Okay, at that time itself, you have to keep in mind the segregation of biomedical waste. And then on-site handling and storage. Every clinical department, wherever patient treatment is given, okay, there you will have an area, where uh, soon after the treatment, doctors and nurses will come and segregate the waste. Okay, that is storage number one. And twice a day at least, biomedical waste handlers or the housekeeping staff will come to the clinical departments, collect the waste that is half full, and take it to the sorting side within the hospital, which is a secluded area, okay, with limited access to the general public. So that this is the on-site handling and storage. And from here, collection vehicles will come to collect the biomedical waste on a daily basis. They will take it out of the hospital premises. That is the transfer and transport. And either they have to process it further so that when you do the final disposal, environment is not harmed. So they have to further process it and resource it, or they have to just transfer it and dump it. Okay. And then comes in both the situation, final disposal will come. Okay. So this is the general process of hospital biomedical waste management, universal process. So coming to the collection and storage of waste. So generation of waste we have discussed. It is done by Group D employees to highly educated and trained professional. Everyone has to do the segregation of waste. Okay. Collection and storage. You have to make sure for the collection and storage, there is a safe water supply within the hospital, facilities for sanitation in respect of toilets and urination, good housekeeping services in patient care areas of the hospital. Zoning is being followed in all the operation theaters. Okay, these things should be kept in mind while you are collecting the waste. Categorization will depend on the size of the hospital as well, how many facilities are available for waste treatment, what are the policies and procedures of waste management. So based on these things, collection will be done. How many people you require for collection. And color coding is also followed. We'll discuss that. Any general or non-hazardous waste which will not cause any harm to the environment is collected in a black color bag. Okay. Any sharp, even if it is infected or non-infected, it will be collected in a yellow colored puncture proof bag, leakage proof and puncture proof bag. Color could be anything, but if it is infected, it should be yellow colored. Infected waste, which is not sharp in nature at all, which will not cause any cuts, bruises, puncture to anyone. So non-sharp infected waste has to go into yellow colored bag. Okay. Human waste, animal waste, any soiled waste, expired and discarded medication. Okay, they also come under yellow colored bag. Chemical and pharmaceutical waste will be collected in red color bag, apart from the drugs that are cytotoxic or radioactive, or any high pressure containers that will not be collected in red color bag. Recyclable, red color, remember it is recyclable, anything that is recyclable. Then clinical waste that requires autoclaving, that will be taken care in either in a blue bag or a white bag. Usually it is blue bag that requires autoclaving. Coming to the storage of waste, according to the waste uh, handling and management rules of 1998, when you hold the biomedical waste for a specific period of time, at the end of which the waste has to be treated and disposed of. The time duration given here is 48 hours. No untreated biomedical waste should be stored beyond 48 hours. And if there comes a circumstance in which you have to hold the hospital waste beyond 48 hours, you have to get a permit from the local pollution control board or authority. An authorized person should take the permission from the pollution control board authority and take measure that if you are keeping the waste beyond 48 hours, in no way it will cause any adverse effect on human health or environmental health. Okay, you have to take the responsibility of that. Next, coming to transportation of waste. In case of transportation of hazardous waste, you have to make sure that neither the operator or whoever is moving with the trolley nor the general public should be exposed to the risk of infections or hazards of biomedical waste. So that you have to take care, which means the lid has to be closed. Okay, there should be a risk sign or signage should be used that others are alert that this is something dangerous. You should not go around it or you should not play around the area. Okay, so these techniques are used. So there are types of transportation of waste: intramural and extramural. Intramural is how do you get the waste from the clinical departments of the hospital to the sorting and storage area within the hospital. So you will use intramural transportation. So there are push carts, waste trolleys, wheelbarrows. You can see here the image of intramural transportation: push carts, waste trolleys, wheelbarrows. It looks like this. Okay, it is taken, the movement of the transportation is taken care by the Group D employees, housekeeping staff, or biomedical waste handlers, how we call them. Then we have extramural transportation. So transportation of waste outside the hospital is called extramural transportation. Rickshaw, van, lorry, okay, these are transported. If the wastes are untreated, um, first the untreated waste must be transported only in such vehicles which are authorized by competent authority for this particular purpose. You can't dump untreated waste in any vehicle. Okay, there is a specific vehicle. It is built or it is structured in such a way that it is capable of carrying untreated hospital waste. Coming to the treatment of waste: chemical, thermal, mechanical, irradiation, biological, and other new methods. These are the different ways in which you can treat the uh, biomedical waste. What do you mean by treatment of waste? A method, technique, or process that is designed to change the physical, chemical, or biological characteristics or composition of any biomedical waste so as it is non-hazardous to health or environment. From hazardous waste, you're converting it to non-hazardous waste. And whatever method you use, it could be physical, chemical, biological, whatever method you are using to make this conversion from hazardous or infectious to non-hazardous or non-infectious. When you're converting the state of the physical state of the biomedical waste, whatever method you use comes under treatment of waste. So first is the chemical method. So in this method, the main method is disinfection. And disinfection, as we know, it is a process by which most of the pathogens are destroyed from any inanimate object, not from tissues. You can't use disinfectants on living tissues. Okay, it can only be used on non-living things, inanimate objects. Okay, like cells, anything that has cells, living cells, you cannot use disinfectant on that. You can use it on materials, surfaces, or inanimate objects. Okay, this is the first most common method, chemical disinfection. So any instruments, chemical methods are used when you are dealing with any instrument or equipment that come in contact with the skin and the mucous membrane. Okay, sharps such as needles, scalpels, syringes, contaminated floors, surfaces such as trolleys, tabletops, clothing, bedding, etc. Okay, ward, operation theaters, ICU, anything that comes in contact with these areas, disinfection has to be done. And commonly used chemicals for disinfection is bleaching powder, alcohol solution, glutaraldehyde 2% solution, detergents, enzymatic detergents, Savlon 1%. Okay, these things are used. These are the disinfectants used in chemical methods. Next, we have thermal method where heat is used. Okay, so this process are used to decontaminate, destroy medical waste. Most of the microbes are also destroyed during this process. High temperature of anything more than when the 100 degrees Celsius is used, we call it as a thermal method. So we have low heat system and high heat system, two types of thermal methods. In low heat system, maximum temperature is 150 degrees Celsius, 100 to 150 degrees Celsius. That is the operating temperature. Your normal autoclaves that you use in hospitals come under low heat system. High heat system is done in industrial level, okay, where the heat generation can go up to 5500 degrees Celsius. Okay, that is high heat system. And when it comes to autoclave, you have gravity type, pre-vacuum, retort type autoclave. These are the different types of autoclaves that can be used for biomedical waste management. Hydroclaves are used, incinerators are used. And again, in incinerator, you have